Dr. Winans. We get so many questions about dental implants. So what is a dental implant?
A dental implant is a titanium post. We use it in the mouth for tooth replacement. So whether you're missing a tooth or you've got a tooth that's damaged or can't be fixed by your dentist, we use a titanium post that goes in, and once it's healed and what we call integrated, meaning fused and stable, then your dentist makes a crown that goes on top of the implant for you.
And what are the benefits of a dental implant?
So the benefits of the dental implant are that it's a tooth replacement. It's close to your natural tooth as possible, and it doesn't come in and out. So it's in there, you can chew with it, you can function with it as you normally would with a normal natural tooth. And so it is a great option to replace a missing tooth. And the benefit too, an additional benefit is that when you have an implant placed, sometimes when you lose a tooth, you can lose bone, surrounding bone associated with the loss of a tooth. And so an implant helps to maintain that bone for the long term for you.
And how do dental implants compare to other tooth replacement options?
So this is a much better option for patients, particularly because one, as we've talked about before, it stays in place permanently. It doesn't come in and out. And it has improved hygiene aspects to it. So a bridge is another option, and the problem with the bridge is that you have to connect it to two adjacent teeth. And those teeth actually get shaved down for a natural crown, and the bridge gets cemented on. And unfortunately, when you cement on a bridge, it becomes very difficult to keep clean. You have to floss underneath it, you can't floss between it. Whereas a dental implant has nothing to do with the adjacent teeth. It goes in, it's a separate standalone tooth that can be cleaned just like a natural tooth would.
And what is the process and the timeline of a dental implant?
So there are a few different ways of looking at a dental implant and the timeline it takes to get your final tooth. So typically, a traditional way of removing a tooth, particularly a molar tooth, is that the tooth will be removed. We tend to place what's called a bone grafting material, which is sort of like a sand material that helps to regenerate bone into the socket. And that healing process takes about 3 months. At the end of those 3 months, we typically get an x-ray to ensure that the site has healed and that we've got adequate bone for an implant to be placed. And then the implant will be placed, and the implant itself takes about 3 months as well. And so over those 6 months, that's the typical timeline for an implant to heal. And then we get you back to your dentist, who will end up placing a crown on that tooth, which takes a couple weeks to get that finished for you. Sometimes we can speed that process up, which is something called an immediate implant. And so in that situation, we take a tooth out and we're able to place an implant simultaneously. And that saves the patient 3 months of healing. So in certain cases, particularly in teeth that are more towards the front of the mouth, we're able to place an implant at the same time as the tooth is removed. And that way we can expedite that process for a patient to about a 3-month timeline.
And how long do dental implants last?
It's a good question. So our hope is that a dental implant should last you forever. Implants have about a 96% success rate, and so there are things that could potentially go wrong with the dental implant, but 96% of the time, an implant's going to last you for a very long time. Sometimes an implant may need a new crown, or if something chips or breaks, just like a natural tooth or a potential crown that you already have. Sometimes the crown will need to be replaced. But these typically last a very long time, and our goal and hope is that an implant would last you for the rest of your life.
If I'm considering dental implant surgery, why should I choose an oral surgeon to do my surgery?
Oral surgeons spend an additional 4 to 6 years after dental school doing just strictly oral surgical and surgical training. We spend that time in a hospital setting doing fairly intensive treatment for both medically complex patients and straightforward patients. So during our residency, we spend time training with all medical professionals. So we spend time with the anesthesia team, we spend time with medicine team, ear, nose, and throat surgery, plastic surgery, general surgery. So we end up obtaining a vast knowledge of surgical issues, complications, and surgical management treatment options for patients. And that's something that most dental practitioners don't have the opportunity to do. So an oral surgeon will spend those years training extensively to learn how to manage patients of all different backgrounds. And although dental implant surgery can sometimes be very straightforward, it can also be very complex. And it's important for your provider to understand the surgical management of a patient in case there's something or there's a complication that arises, and that's something that we can manage and treat very well. We also have to go through a fairly rigorous board certification process, which allows us to maintain a standard of care among oral surgeons to ensure that we're treating patients appropriately and understanding the surgical options available to all patients.